Please give us an opening speech, Professor Jubilee.
So I invite first my best friend, Professor Zhang. You know, it's a great pleasure to see him. Unfortunately, online, but we met many times in many meetings. So thank you very much, and I would like to invite, because this is normal, Professor Zhang said, if it is possible, of course. Yeah.
Okay, so we know, well, in China, the COVID-19 almost gone. How's the situation in Romania?
It's okay. I think it's good. Now we are a country with very few cases, so it's okay. Now it's okay. That's why you can see here in this operating room a lot of participants.
Recording in progress.
Yeah, so you can see this. Okay, I hope.
Good. It's really nice to see that the situation is really nice in Romania. Also, as you can see, Professor Zheng and me, we are not wearing masks. So the pandemic currently is quite nice in China. So let's welcome Professor Zheng Guohua to give us a speech.
Okay.
Yes.
Professor Patricia and dear friends and dear colleagues, ladies and gentlemen, in China, good afternoon. On behalf of IAU organization, Chairman Professor Kemo Sarek and Professor Zhang Chunye, I really thank Professor Patricia, colleagues, my colleagues, and urologists all over the world to join this flexible uroscope live surgery. First, I will take a few minutes introduce our society, IAU. Actually, IAU was founded in 2012. So far, IAU member has been to up to more than 1,000. All members are from more than 100 countries. So I welcome everybody to join IAU family. Secondly, I think RIRS flexible uroscope is a good option for treatment less than 2 centimeters real stones. This is a good technique, but post-operative fever is the main complications. I think fever is caused by intraocular pressure. I think how to lower pressure, which sometimes is very easy. I think you must increase cyst size, but you increase cyst size maybe cause more and more risk to damage your ureter, and sometimes you can decrease flexible uroscope size. But so Chinese company Pusen has manufactured this 7.5 range. This is really scope, really nice scope. What about this scope? I used not too much, maybe 5 times. Summary in one was perfect. Yeah, as Chinese saying is believing. Let us see, or Professor, my dear brothers, Professor Patricia's live surgery. Begin. Okay.
Okay, thank you very much. So if I appreciate a lot our meeting. It's a great pleasure, a great opportunity for not only for me, but also for Romanian neurologists, and also it's a great occasion to demonstrate our operating room. We have 4 operating rooms, and this is the number 3. So if it is possible to put a little bit on the camera too, yes. I don't know if you see my brother. You see this image from the camera?
No, we didn't. We don't. But we see this camera. We can see your face.
Okay, so he must move a little bit. These are my workers, and here is you know, all some of our instruments, endoscopy instruments, and this is our operating room, and there it's you know, the LCD with you, wonderful. And here it's there are 3 lasers. You know, I put only 3 here.
3 lasers.
Yeah. We usually there are Dornier 20 watts and 30 watts, and now we use this wonderful tool. It's Olympus, it's Soltive, it's, you know, TFL. This is the next generation, the best, I think. So I try to demonstrate this to Soltive, performances. So what about our case? So please put my presentation to just 3 slides in order to present, make the introduction. Yes, the next slide, please. I don't know if you see this presentation.
I cannot see. Now you can share your, yeah. It's okay, it's okay. It's okay.
This is our hospital, St. John Clinical Hospital, and I put there EAU, I mean, our organization. You know, I care a lot about this EAU.
Thank you.
Okay, and the second one is our hospital. And the next slide, please. The next slide, please. Yes, this is my introduction. The next slide, introduction, please. Good. So I put here the stone bridge between
Last name. Stone bridge, really nice.
Yeah, and Guangzhou, you know?
Yeah.
Bigger image. And in this, you can see between us, there are a lot of kilometers, miles, you know, and it's not important because we realize this stone between us. Look, it's here. It's about 5,000 miles and more than 8,000 kilometers. But no matter, we are very close, and now we're using online system. We can perfectly discuss about our cases. The next slide, please. Next slide, yes. Of course, once again, I appreciate a lot Professor Hua Zheng. It's one of the leadership in endourology in the world, and I'm so honored to be together with him in this real life operation. I mean, live surgery. Next slide, please. And the next slide, please, is with our case, because we have to hurry a little bit. You know, it's a woman with this image, with laboratory findings, no infection, microhematuria, and of course she had 2 years ago another flexible laparoscopy, but I assure you that CT control after 3 months of at this time was real stone free. The next slide. Well, the next slide is, in EAU and EAU guidelines, everybody said that the most important is the larger diameter. I disagree. So I think that the most important is the volume. And this stone, it's if you can see there, it's about 13 and around 13, around 7 millimeters. So it's a stone which it's not only, you know, it's important, very important, the volume. So coming back to our operating room, please. Camera number 2, please. I need camera number 2. It's okay, I can see. I cannot see.
It's okay. It's okay. I can see.
Good. So I already, because this patient has RIRS 2 years ago. First of all, I verified the ureter. So I made a semi-rigid ureteroscopy. And because I was obliged to see what happened with the ureter, it's very important. It's not usual. In my department, ureteroscopy before is not usual. But, you know, in some cases, we apply this. Another thing, we already put it this kind of guide wire. I like a lot this guide wire because it's you can see closely. And this is give me this one. Come here me.
Sensor guide wire.
Yeah, this one is the guide wire is from Rush. It's wonderful tool for ureteroscopy because here is flexible and here is semi-rigid. It's wonderful tool because, you know, when you put the access sheet, it's so easy and very safety. So look to me in this moment. This is the guide wire and this is the access sheet. Access sheet, if you see, please, this is Olympus access sheet. Olympus access sheet. I like a lot because it's this part of this access sheet. And of course, we will put the access sheet. Okay, and now a little bit discussion. You know, I don't care about X. You know, I will put this access sheet very easy, very easy.
Professor, I can notice the X-ray image. Please show your X-ray image.
Please, X-ray imaging. So.
Oh, now now it's okay.
Okay. I need X-ray imaging. X-ray imaging, please. Big mass laser, please. Okay.
Professor, you can only one guide wire, no safety guide wire. It's only one guide wire.
Look, my friend, no guide wire, no X. I don't need it. Look to me. Please come with the camera here. Come here. It's very easy. Look, this is the access sheet. This is the guide, you know, and
yeah.
Easily we can put without force. Look, easily, it's okay.
It's okay, relax. No safety guide wire for you. You only one guide wire, no safety guide wire.
No, because I feel with my finger where is the access sheet. I joke a little bit. So no, I don't need radiology. It's very easy. Look, the access sheet is 10-12. This is important. And I would like to show you also this absolutely great tool that you already said, you know. This is Pusen 7.5 French. It's a great tool, you know. We started to work with this kind of instrument last year, and it was wonderful, absolutely wonderful. So why? Because it's real minimally invasive, you know, without problem for the ureteral mucosa. So I will enter into the access sheet, and now I need to please put the camera and the endoscopic camera. Yes, it's okay. Good. Let's see. Dar nu văd nimic ce să meargă. Unde merge? I don't see nothing. Okay. Okay. Do you see now? The camera?
Yes, we can see. Yes, we can see.
No problem. I am in the access sheet. Look, the image is very, very good. And I advance in 10 seconds. I will be in the kidney. Look, it's very easy. Look here. I am here. And yes, it's. And now let's see what is here. Okay. Let's go into the kidney. Okay, it's a little bit, it's a, okay, let's see now. We are into the kidney, I think now, yes. It's very clear now. And let's see the stone. It's, I told you it's a stone, you know, because we discussed about the volume. This is the stone. This one is the stone. You can see now perfectly the stone.
Yes, we see the stone.
Yeah, exactly. Yes, there are some clots. Okay, but now you can see the real stone is the diameter of the stone is so I think, you know, about 2 centimeters in all diameter. So it's not the volume is not so easy to treat this stone, because you know, I told you EAU and AUA said, okay, you must evaluate with the largest diameter, but it's not true, because you know the volume could be double if the rest of the diameters are also 2 centimeters. Okay, so now I will introduce the laser fiber. Yes.
Professor, one question for you. Before, usually before RIRS or flexible uroscope, you usually put a DJ stand before RIRS or not?
No DJ stand. No.
Oh,
it's
good.
It's a patient without DJ stand. You know, the unit was very, very clear. Now we will try to introduce be mai mult lumina.
What about the position of sheath? Sheath is in the upper ureter or below 1 or 2 centimeters UPJ or UPJ?
Wonderful question. So I need that you know, to show you that this access sheet is 2 or 3 centimeters less than UPJ. I mean, on the ureter, you know, down to the. Okay. So this is the best, I think, position. And now, So now I'm looking for the laser fiber. So now I would like to show you a little trick. You know, when this happens, because the patient has a movement, important respiratory movement. Look, this is the fiber laser, is very clear. And here the stone, also very clear, the stone. Okay?
Okay, I can see stone. What about your laser setting?
I would like to show you the settings. Now please move to the camera. Yes, and you can see there, it's already arranged 0 to 100 hertz, 20 watts. You know, this we started with this, but you see, because
is dust in setting? Dust in setting.
Yeah, great, nothing. But you know, I can adapt this. Every stone it's an entity. So you must adapt this for every stone. It's not please fix my kidney. Okay, you can see how my co-worker helped me. He fixed the kidney because it's a problem with the respiration. And now, let's go.
Okay,
Good.
nice.
Good.
Good, very nice. What about the irrigation? Irrigation, you use pump, you use pump irrigation or glue it? 还有什么关系呢？
You see, just one second, stop. Look to this laser, it's absolutely fabulous. In 3 seconds, you know? Go. Very good. Very good. Oh, let's see. Okay.
Professor, what about your irrigation method? Irrigation use pump or other irrigation? Irrigation.
Irrigation. Wow, it's so easy. I can show you. Please, camera 2. Stop here and put camera 2. It's here. My system is gravitational system. Look to the system. It's only this.
How high? How high? Is 2 meters? 2 meters?
No pressure, you know, it's the best. Okay, let's come.
Okay.
The stone. Now we'll treat this stone. Go. What is impressive to this Soldive is that you know you can treat the stone very quickly. Look what happened with the stone. It's completely polarized. And if you look to the stone, there are 2 compositions, you know?
I can see. I can see.
Completely black. And the rest of the stone, it's you can see it's brown. And it's so easy to fragment the stone. I told you it's I like a lot this kind of laser. I mean TFL laser, because it's really very, very good. And you know, you must remember that this stone is 2 per 2 per 2 centimeters. So this is a problem because you know it's a big stone. It's not so easy. So I'll try to find, you know, there are some techniques, and I use especially dancing technique in the first time. Look like this. Like this. I move on the stone surface, and I look. Something like that.
Professor, what about this scope? This scope is good? Do you think it's good?
I like a lot this 7.5, you know? It's very easy. Yeah, it's very easy to... now I think that the stone is a little bit stronger that we put it. I mean, look, I change the power button. I can see. Let's see. Okay. So this is the stone. Yeah.
Professor, your sheath size is 12 or 10 French.
Look, the stone is perfect now. Look, you can see this is important now. You know, we change the frequency. Yeah, because it's a hard stone, but it's not a problem for this laser.
You change the laser setting? setting.
Yeah, I changed a little bit the, the coordinate of this laser, the lithotripsy.
How much joules?
Now
0.6.
It's 0.3, 160 frequency, 160 hertz, and 48 watts.
Okay.
Because I feel that this stone is too hard,
I know. I see with the heart.
Yeah, exactly.
So, Professor, sometimes a bit of the hard stone, maybe you can use fragmentation setting, sometimes high joules and the low frequency.
Yeah, I know, you are right. But I don't see perfect now. It's okay.
It's okay, yeah, it's okay. Hello.
Okay now. Yes, please. My fiber. Yes, good. Go. It seems to be not slowly, but this is very efficient, because if you look here already we made, an important disintegration part of the stone. Look, and if you look in the end of the day, you will see that this stone the fragments will be 250 microns. That means it's absolutely amazing. We in all the papers we said, okay, if we have 3 millimeters is perfect, or 2 millimeters, or in the last papers 1 millimeter. I mean the residual fragments. But here, with this kind of laser, the residual fragments are only 250 microns. It's quite impressive,
Hello. What kind of your laser machine is? Which Lisa? Which kind? Brand?
What's the brand of your laser?
Yeah, exactly. It's so important, to treat the stone in very, very, very thin fragments, because we don't need sometimes double J. Because why double J? After this operation, if you have fragments like this, I mean 250 microns, is not necessary. But once again, you can see the stone. It's working well. Go. Okay. Okay. So this access sheet, it's important to be fixed, and in order to have the okay. Okay, now it's perfect. Good. With the fiber, please. The fiber is good. Go. Go. Exactly. Go. Look, now I try to apply the chipping technique. I mean, the chipping technique is to treat, Okay. Good. In order to destroy, the margins of the stone. I mean, this is here, the stone is here, now it's clear. And now let's go. Good. Good. Stop. I need to keep my scenery into the here we have a little problem, and it's good for demonstration. You know, with the respiration. I mean, this patient has a very strong respiration, so it sometimes is difficult for me to fix this one, you know. Okay, now it's okay. Yes, please, your fiber. The fiber, please, and look how it treats. I try to make the chipping technique here. Stop. And here. Good. This is a chipping technique. I mean, I will destroy, you know, the margins of the stone. Look in here. Now it's okay. Awesome. Okay. Good. It's perfect. Okay. Let's try. Good. Did you see the margins?
I can see.
Yeah, it's a really very good image. And the patient is, you know, there are two things for this. I mean, three things for the difficulty. The first one is the movement, the respiratory movement. This is a problem, and you must fix this. But it's not a problem because with a very good assistant, so you can see perfectly the stone and you can treat, because you know when you destroy the stone, I mean in the margins, it's a little bit, you know, the difficulty, because you can destroy also the urethral, the myelocalcial mucosa. So it's not so. Just 1 second. Okay, now let's go. Very good. Go and go. Good. Let's see how it works. Oh, this is the posterior wall of the myelocalcial system, and now this is the stone. Okay, let's treat. Okay.
I think this stone is impacted. Yeah, Professor, impacted stone.
Yeah, we impacted stone. Yeah. Another difficulty of this case is the impacted stone. You know, it's very, very near to the look. I treat exactly one millimeter. I don't know, even less near the myelocalcial mucosa. So it's not so easy. In order to be very, very minimally invasive. And look to the stones that we obtain. It's amazing. Look, it's absolutely amazing. 250 microns. And let's go and continue. Okay. You can see now the calyx. Stop.
Professor, good news. Professor, here you go the news. So far, 1,200 urologists see your operation.
Yeah. Thank you very much, my friend. So we try, you know, because you know, usually when you choose a case, you choose a very easy case. But I think it's better to describe a difficult case like this. You know, the position, the structure, and also the volume, and also impact stone. So a lot of problems, you know.
No.
Okay.
I think this case is good case. Show every technique to the younger urologist. I think it's good.
It's important, yeah. Look, this is the real chipping technique. This one. Top. Good. And let's see already. We advanced a lot. Good. It's good. Now let's see here. Go. Go. Okay. Okay. Good. Excellent. Did you see this is an impacted stone? It's a difficult stone. I try to move a little bit this stone is you see your telescope and look after what I did. The stone was a little bit moved from this impacted position.
I think sometimes urethral impacted stone, maybe you use laser, break this stone is really dangerous. Sometimes cost to your urethral structure. Yeah. Must be careful.
Yeah, this is for the ureter, but for the firing system is not a problem. The problem is only for us in order to destroy this stone, you know.
But impacted in the PVJ, impacted stone in the PVJ, you must be careful because sometimes your laser is fire the mucosa, cause some bleeding, then endoscopy is too bad, then you must stop your operation, put a DJ standard for stage flexible uroscope.
Yes, I can completely agree with you, my friend. You know, I advise my coworkers also not to hurry. So, you know, look here. The entire case now is free. It's very.
I see.
It's perfect image. And now I will try to destroy the stone, to disintegrate the stone that is up.
Okay. Professor, another question for you. Sometimes you do impacted urethral stone. Maybe you use flexible, you use laser. Maybe it's very easily cause this urethral structure. How to prevent this complication?
Yeah, you are right. You know, impacted stone, this is a problem. In the ureter, you know, sometimes you cannot see nothing. You know, you see only edema and no the stone sometimes, and you try to act now, and you try to put you know the guy safe wire, and it's not possible. The guide wire doesn't pass. So what do you do? So in this situation, I try to fix to continue the laser, you know, just through the edema. So the edematous ureter. So it's not so easy.
Yeah, sometimes it's difficult. But in my experience, I usually sometimes for this I meet this situation impacted urethral stone. I use simulated uroscope and go in and use numerical laser chips and push the stone back to the pelvis and collect system, and then I put a sheath and use flexible do it. I think you can prevent urethral structure caused by the laser damage. That's sometimes you can do, but push this stone, upper urethral stone back to the pelvis and the collecting system. This is good.
Now I would like to show you something, you know, a little trick. Look, this is a stone. It's an impact stone. What can I do? Because it's difficult to treat in this position. I will go like this and like this, and I would like to move a little bit the stone. Look, like this. And once again.
Sometimes for this impacted stone, impacted the mucosa of calyx, maybe you can try to use basket remove. You can try to basket remove this stone from the mucosa and separate from the mucosa. Then the good. Sometimes it's difficult because the impact is very tight. You cannot easily remove this stone from this mucosa. So person must be careful.
I know, but the problem is, you know, this, with this fixed stone. I mean, this is the chance, you know. But I choose this stone because it's a very difficult stone. It's fixed and the large stone, and you know, it's a real problem to treat the stone, but
Professor, show your irrigation. So water in and water out. Irrigation in, irrigation out is okay. You can show your sheets. Show for everybody because with this small size flexible uroscope, maybe irrigation out is really nice. You show this this for everybody. With the camera show.
Please,
Can you show us the draining from the sheaf? Since it's a small scope.
Exactly.
I cannot see.
We can't see.
You can see. We can come here, please. From here. Stop. I think it's better from here to push. Go. Good. Look here. Now we move the camera and look to the it's accessory and look to the flow. It's very good.
Yeah.
Now we can see.
I see.
We see the flow.
Yeah. Flow is really good.
It's really very good. No problem. Look.
Yeah, we can see. Very nice.
Okay, thank you. So
I think its pressure is really low because outflow is really nice, really good. Maybe intraoral pressure is really low, I think.
yeah. So now can we see perfectly the impact stone is gone? Look, it's clear now. Can you see?
This is upper pole, no?
Upper pole, yes, but look here. It's a great imaging of this 7.5 French. Look, great imaging. And I will go into the upper calyx and this free.
Yeah.
And these free stones.
I think you can try going to the low pole, low calyx.
Yeah, this I will try everything. No problem.
Hello.
This is the calyx, and the secondary calyx we can see here. It's a little bit. It's not a problem. And this is the phaeolic. Look, it's great view. Absolutely great view. Do you see?
I can see very clear.
It's a great, absolutely great view, and you know we'll move a little bit to see. Here was the impact stone. You know there are some fragments. I try with the ureteroscope to not to to be here, you know, because if you don't treat completely, maybe they could be points for recurrences, you know. Look, now it's clear, and this one is clear. It's okay. So if you look to the final aspect, look here, it's completely done. And this was, you know, they impacted. Look on the mucosa. And I try with the ureteroscope to, you know, to remove this fragment, you know, because this,
you use scope push this, move this stone.
Yes, yeah, exactly. Look, if I try
because this is single use, because this is single use, it's reusable use, you cannot do it.
Look, sometimes I try with laser. Please look here. I need laser. Good. Look what happened with lasers. These little fragments will disappear. Okay.
What about your laser setting for this? About laser setting is how what?
The energy, the pulse energy is 1 joule, and the frequency is 30 hertz. I mean the power is
1 joule, 30.
Exactly.
Yeah.
So now let's see the other calyxes now, because we would like to be very complete. And this is
Professor, you are expert. I never do this. We really dangerous because sometimes you use laser fire this UPJ mucosa. Maybe sometimes dangerous.
So look to this impressive image. You know, the fragments are very little, and this is the thing I told you.
I think this some stone is impacted in here, in this side. Yeah.
Yeah, it's not only impacted. Is, you know, this is the mucosa.
Yeah. Here.
That's why I tried mechanically using my single-use flexible telescope to move these fragments. You know.
Yeah. Good. Really nice.
And now this is a little bit bigger. I think, I don't know. We'll try to lay it.
I think so. Sometimes first you use the scope, move this, push this stone, split from the mucosa, and then you use maybe it's a really nice technique.
And look to this wonderful tool that I told you. I mean, Soltive. It's amazing tool, because you know you can destroy also these fragments. It's not there are detritus. I don't know. It's not top. Very good. So let's see more, as you said, and here let's try here a little bit this laser, just to show. No, it's not stop. It's only the bright. You know, all these kind of there are no stones. There are, you know, some cellular detritus. I don't know in English exactly, but maybe
Professor, for this piece, for this small piece, you usually use basket to remove stone fragment for stone composition.
Yes, you are right. You know, I will destroy also the rest of the fragments, but really good. I like a lot. And now I will go to the inferior calyx. Look, this is the inferior calyx. Here.
This is local. Yeah.
I will try to enter into
Professor, after operation, after RIRS, how many days you will put a DJ stand? 2 weeks, 3 weeks, or 4 weeks for you?
My brother, look, this is the inferior calyx. It's completely free. Okay.
Yeah, I see.
Good.
How many days for stenting?
So, you know, generally speaking, 2 weeks. I put a stent for 2 weeks in some cases.
2 weeks. Okay.
Yeah, only 2 weeks. But once again, this calyx is completely free. Let's go. Yes, it's completely free. Look.
Nice, nice.
Good. This calyx. Let's go here. Let's go. Go. Excellent. Let's go. It's completely free. Okay.
Okay, nice.
This is inferior calyx. And now let's see.
Last question for you, Professor. After operation, you must check your little condition. Sometimes you must check your little is injury or not injury. You must check it or not. Do we check your little?
Now, sorry, now I will try to extract this fragment, you know, with what you said, with Dormia, I mean zero tip, because I would like to show you finally without nothing in the kidney, you know, I mean completely free. It was a nice case, I like it. But you know, in a demonstration, it's sometimes it's difficult. The difficulty is double. Look, it's okay, and I fix this one. Just a second, okay. I fix this one, and okay. Just once again. Okay. Yeah, no. Right.
It's
right. Yeah. Oh,
which kind
good.
of basket? This basket is.
It's good. Look. Excellent.
What is that basket?
Good. Yeah, it's here. You have to move the camera. Is this one? It's okay? Did you see?
I see.
Yeah, but there are a lot of fragments here on the.
Oh, nice. I see.
Yeah. Let's go once again. Go to the kidney. Let's see. Okay. Now once again, please give me your basket. Okay.
应该是普生的是吧？
Okay. My basket will arrive.
普生的 plus S。
Now you can see, look, I will finish my job, you know?
I see. Nice technique.
Yeah, it's quite easier, no problem.
Yeah.
Okay, let's see now if we have something less. Now, look, my friend.
Yeah, really nice. Stone free.
This is final aspect, you know? Look, this is the filing system. And as I told you, you know, this is the ureter, and now we enter into the kidney. Very easy, and this is final aspect of the filing system. It's really extraordinary. This Soltive, you know, the fragments already were outside, so no fragments, you know, because they are very thin. I mean, 250 microns, and this is the final aspect. That's a little bit here, but it's okay. It's okay, really okay. I like a lot. Look, it's here. Here, there are some fragments that will be maybe here. Let's try once again. Give me your trivia. Yes. This is just for the audience, you know? Just for fun, because it's, okay?